And you'd mentioned that something that you're started to do more and more is just like guided things with various technologies and using the use of robotics. And I guess like how has robotics started to influence some of the spine surgeries that you're doing? And what are you seeing within the field of spine surgery?
I think robotics is really in its infancy in spine surgery, where it's been around for over a decade, but it's still at a point where we've got a long way to go. And so I use some robotics, use some in my fellowship, and it's become an instrument to plan surgeries better and to kind of place the screws when you're doing a fusion successfully. Now, most spine surgeons are well trained in placing screws. So I think some of the, maybe the older generation are slower to adapt to this type of technology because the argument is, well, I can put a screw in really well. And the studies show that, right? So it's more of a paradigm. It's more of a philosophical kind of shift in, well, we're going to use this software to help us plan our surgery and maybe be more thoughtful about certain things of the surgery and certain angles we're trying to correct and certain things that where exactly we want the screw to be for reducing adjacent segment disease problems, things like that. It's not just putting in a screw. And so I use a lot of navigation. So I basically use an intraoperative CT scanner that scans the patient with all of us outside the room. So it limits radiation exposure to the staff and things like that. And then we basically use a navigation device that uses probes that kind of match up to a camera, and it can reference it in space. So there's a static spacer that references it, and then any of your instruments are mobile, and so the camera can visualize where you are in 3 dimensions using a CT scanner that was just done on the patient. So that allows us to again place screws and plan where we're going to place things in live time, which I think really helps with it helps with outcomes, and it helps with really being thoughtful on the type of surgery you're going to do. And I think we're really just in the infancy of developing haptic feedback and figuring out how to use robotics to help us, do decompressions and measure like how much bone resection we need to take to decompress the neural elements, but not destabilize the spine and things like that. And I think we're 5-10 years from being at the peak of robotic spine surgery. So, which is kind of exciting time to be in. We're learning a lot, we're figuring a lot of stuff out. But it's not at a point where obviously the robot's doing the surgery for you. It's just kind of it's an assistive technology to help us, improve outcomes and surgery.
I had seen this one surgery, it might have been on LinkedIn or somewhere, where I saw it was like some guy in a different country was performing surgery on somebody from somewhere else. And do you think that that's going to be something that people are going to be able to do? Perhaps like a neurosurgeon in California is operating on someone in the middle of Oklahoma. Do you think that's going to be something that's going to be in the future? Or you think we're pretty far away from that?
I think we're pretty far away from that. Honestly, that's like a Da Vinci type robot that can, has the arms and that can do things. I think there's going to be certain things that you can do with that, right? Especially very tedious things, maybe repairing a dural tear that you can use the little arms to do, or maybe excising a brain tumor or an intradural tumor in the spinal cord and things like that. But I think we're a long way away from being outside of the surgical field and operating.
Got it. And we've been talking about how many factors go into low back pain, and we're also talking about technology. Do you feel that AI is going to start to have an influence on considering all these factors and determining whether or not surgeons are doing the right thing, and how we can perhaps have better outcomes moving forward as surgeons, PTs, and others?
Yeah, I think that's probably going to be the most important thing we're going to see in the next decade. And my institution I trained at was very, very big and on the forefront of using AI to develop kind of algorithms and improve outcomes, right? So I think that if we can get better at picking surgical candidates, then we're going to improve outcomes, right? We're going to see more people being happy with surgery, more successful surgeries. And I think that comes down to the fact that we are doing our best to investigate pain generators and see if we can fix those, whether it be from a non-operative standpoint, physical therapy, medications, or from a surgical standpoint, and which ones are going to do better with what. And so if you start to develop an algorithm, a tree of patients, and that you can cluster those patients into specific categories. You've got a 50-year-old male with these radiographic and MRI findings, and you've got data on 1,000 of those exact basically phenotype patients, and you can be like, well, this was their outcomes for each different thing, and you can say, well, this would be successful in this amount 65% of the time or 0% of the time, right? So it could help us to kind of make a decision based on past experiences, and not just my past experiences, but past experiences of my colleagues. And once it becomes a collaborative effort, we obviously can expand that amount of people that we've helped, and we can look at that like database and be like, well, I think I can help you, or look at, I don't think I can help you, I think that we should do this. So I think that's going to really, really be important in helping to improve outcomes and figuring out what the right, when it's the right surgery and what the right surgery is. A lot of times maybe we do too much, when we're trying to correct a spine surgery or spinal deformity. And, we have, historically, we go to specific levels in the spine because we know that based on our past research that the incidence of an adjacent segment problem is higher in certain areas versus not in other areas. But, maybe some of these people will do really well with a smaller correction, just as well as they would have done with a larger correction, and we can save them a bigger surgery. It doesn't mean that they both didn't have successful outcomes, but you're adding more risk to the surgery and things like that. So I think we're going to be able to learn to tailor surgery a little bit more. And if you can do less, then that would be amazing. My mentors always said, it's like, you need to figure out when you can do less and when should you do more, right? So, and I think that's where AI is going to help us.
And I'm sure as a surgeon, one of the things that you do value the most is what your mentors have to say to you and the things that they try to influence on you. But I'm wondering, the day that comes when AI is perhaps so good at determining outcomes and figuring things out, whether maybe a discrepancy between like someone who's been doing surgery for 30 years and then AI is coming along and like saying, well, I don't know. And do you feel like there's going to be a big balance? There's going to be an issue between like people coming in with AI technology to say like, hey, like we think you should be doing this, but like, you don't know shit about anything. So why are you telling me how to do my job? Do you think there's going to be an issue with that moving forward?
I think that we actually discussed this. I was just in Park City with a meeting, and we talked about like AI and big data. And the biggest concern about this is from an insurer standpoint, right? Because they would love to get AI. Like they already do this, right, to figure out who's insurable and who's not and things like that. And so they would love to have AI data on patients to know who they should deny surgery for. So we have to stay on top of it as surgeons. We need to control the narrative because we are the ones that are collecting the data and are using it. So I think it's going to be a fine line of using the data correctly to kind of aid in your clinical assessment. It's not going to take place of, obviously a clinician's assessment, but it'll help you narrow down specific things when there are a few options maybe at play. But yeah, if we don't keep a close lid on it, and we don't control the narrative, and we don't bring this to the insurance companies and to the rest of the population, then it could become a big problem.
Yeah, one thing I fear that it's almost like taking the art form out of surgery. Like what you guys are doing and what you're practicing on a day-to-day basis is like incredible, and it's something that's amazing. But if some technology decides to come around and be like, you need to do this now, it's almost like you're taking the art form out of surgery, and you now become a puppet and a subject to this piece of technology. And I'm sure that's got to be I'm sure you guys can see the writing on the wall long before it happens. But I guess like is it just having these discussions, you think that's going to hopefully minimize and stop this from happening?
Yeah, I mean, I think that you have to keep it in the back of your mind, and it has to be on the forefront of us figuring it out. But I don't think you ever lose the art form of surgery. If I think that part you still need. Like I think that there's still that human component that makes surgery so special. Like having to figure out exactly what needs to be done. I think it's just it would be a great added tool, and if that's the way we can treat it, then I think it's going to be instrumental in helping outcomes. But I totally agree that it's a very fine line. Something that could be easily exploited in the future, and something we're gonna have to be very vigilant of our societies and things like that of keeping that from getting out of control.